so let's go ahead and dive in. So what's really interesting is that we've come to this conference. There's been a lot of different areas that people have moved into as far as benefit design and benefit strategy, but there's really this healthcare landscape that employers are having to navigate actually all the time. And this year has been a year of a lot of firsts. For not only consumers, but also organizations and even startups that are coming up into the industry. They're having to navigate all of this. So I'm going to highlight just a few of the following forces that everybody's having to work through. So we've seen a lot of mergers happening, anything from health plans and PBMs to hospital systems. Everybody's coming together and pulling apart and coming together again. So how that's all going to settle out, we'll see the outcomes of that. But as we move into specialty drug costs, we're starting to see that this is something that employers are starting to wrap their arms around, but yet they still have some things that they need to take a look at, as well as how their patients are getting outcomes, and also access to the right drug. So we're also looking at smartphone technology. The idea that we can access a doctor right in the palm of our hand is something that's already happening, and we're going to see that technology moving forward. And then cybersecurity concerns. We've seen a lot of things in the media around that, and that has employers really worried about what's happening with their data. Another force that's actually moving in is consumers being able to manage their money a little bit differently. Because of HDHPs coming out into the marketplace, employees are having to really learn how to navigate the healthcare system more than they ever have. And so their ability to be able to manage their money is becoming even more critical. And then taking a look at behavioral health care. Before, mental health was really on the back burner. It was something that many employers have pushed aside, but that's actually now coming in the forefront. And a lot of that has to do with the multidimensional health focus that's been coming forward in the last few years. And then also moving out into the community. A lot of businesses are moving out into the community looking at value-based care and how that's actually beginning to impact the overall care of patients. And then lastly, taking a look at data analytics. Data analytics, bringing the whole picture together, taking a look at not only improving patient care, but how is that looking for consumers overall as far as their health. So this is pretty much an overall picture. We won't dive into each one of these today, but each one of these have impacted all of these employers up on the stage. And so as we move in, all of you have come to a variety of these different sessions here. I'm sure you've gotten a lot of key messages. Here are all the different areas that have been focused on. Hopefully you've been able to gain a lot of wisdom and pearls from a lot of the presenters that have been coming to the IHC this year. And as we move into this particular session now, we're working on looking at employers' top priorities. They've been working in this dynamic for a really long time. They're actually looking at making a lot of changes in the way in which they operate in this dynamic because things are showing up differently for them. So it's not just about reducing healthcare costs anymore. They're looking at high performance strategies. They're looking at making changes to their benefit plan. They're looking at not only reducing, but even maintaining that cost trend. And then, as always, looking at employee engagement. So I'm actually part of a business coalition called the Midwest Business Group on Health, and we do benchmarking surveys with our employers really pretty much every year, but this one is our Health Benefits Management Survey, where we look on a number of key priorities for our employers. I won't read through each one of these. You guys can pretty much pick out what is a priority for our employers. We're going to touch base on a lot of these today. And as we take a look at just overall benefit strategy trends, we're seeing a lot of changes happening in the marketplace. A lot of employers are looking at being very proactive around their benefit design strategy. A lot of them are also looking at the impact of the ACA excise tax and whether or not that's really impacting their strategy. A majority of them are saying that it's having no impact. So, but we'll see as time goes on. We're also looking at centers of excellence. Right now, employers only have about 31% that require this, but they are anticipating that to increase exponentially by the time we reach to 2018. And then also looking at benefit differentials for high performance and narrow networks. Right now, this is very, very small, but again, another key benefit trend for employers moving forward. And then the last three areas before we jump into our panelists, looking at telemedicine. This has actually become a very key trend for employers. Some of them have actually implemented some of that. Looking at health and wellness apps and portals, and also decision support tools. All of these are emerging trends and moving forward exponentially with our employers. So let's go ahead and jump into our panelists. Let's see what they're actually doing at their organizations. So today we have with us David Hines. Please raise your hand. He's the Director of Employee Benefits Metro for Nashville Public Schools. Then Olga Rupert. She's Vice President of Benefits and Compensation for Hub International. Kristen Vajura, yes, okay. Benefits Manager for Zurich North America. And Bart Carlson, who's formerly Senior Director of Global Benefit Strategy for Kenagra Foods. All right, let's welcome them all. All right, so each one of them are going to share their strategy. David, we're going to start at your end. Sure. I'm going to pass down the clicker.
Thank you.
And you can go ahead and move into your presentation.
Good afternoon. If you don't mind, I'm going to stand for a minute so I can see you a little bit better as I try to search you out. But I am David Hines. I am the head of benefits for Metro Nashville Public Schools. You know, that little music venue about 4 hours north of here. Nashville is a very diverse, and even though we're nowhere near the size of Atlanta, we are actually the 41st largest school district in the United States. We are very urban, very diverse. We have about 140 different languages in our school district. One of the oddities of Nashville is basically is immigrant central. We actually have the largest Kurdish population in North America, largest Kurdish population outside of Kurdistan. So we have a lot of different challenges, a lot of different things going on. One of the challenges that I have to deal with is basically I have two different health plans. I have a health plan for my teachers and I have a health plan for everybody else. The health plan for everybody else, such as myself, non-teaching staff, is being controlled by Metro government, so I have no control over what happens there. And so 4,000 of my employees are underneath Metro government plans. The other 6,000 plus active employees are underneath my teacher's health plan, which we actively manage. Along with the active population, we also have about 3,000 retirees, so it's about 9,200 lives, 17 to 18,000 total member lives is what we deal with there. So as I speak today and I give you different numbers and statistics, I'm focusing in primarily on teachers because it's the population I can control. You know, one thing about Metro government and being in education, you know, you have to find ways to tie into the mission as a benefits person. And where we tie in is this basic statement. It's part of the overall mission statement, and said that we're supposed to put an excellent teacher in every classroom, every year, every opportunity, basically. Well, you know, in my profound deep thinking, I think an excellent teacher must also equate to a healthy teacher, and that health has something to do with job performance. To that end, and my timeline starts in 2006, that's when I actually started at Metro Schools, is basically we set a mission to look beyond the cost of healthcare alone into looking at this health and productivity paradigm, so we could basically understand more of what the impact is beyond the healthcare plan on what happens within health. Our first step was to address this concerns was to launch a network of on-site medical clinics. Where I came from philosophically is I believe that the best people who can help us improve our healthcare systems are those primary care providers. And so what we've done is try to basically put the primary care providers back into the center of everything and give them the basic control over the health of the group. But I didn't want just any primary care providers. I decided we wanted our own primary care providers. And so we took existing classroom portables that are sitting around, we remodeled them, and we set 5 of them around Nashville. You can actually take a classroom portable and make 4 exam rooms, a lab, a nurse's office, a very small reception area, and a very large, nice handicap restroom in one classroom portable. So it's a full primary care, family nurse practitioner run, and beyond that, we took the concept that this was going to be a medical home. And we have had medical home designation. We changed vendors who provide it, so we're basically back in the same thing. We also wanted to basically remove any other barriers to care financially and time-wise. The whole concept was no more than 15 minutes from any work site, no more than a 15-minute wait. Today, we have about 1/3 of our employees do consider our clinics as our medical home, and that percentage continues to rise. To even help embolden that group and move even farther, we even took another step in the value-based designs in the fact that we made our clinics our disease managers. Along with that, in order to drive participation, even though it was zero cost at that point, we started giving away drugs. If you're a diabetic in our programs, you get all your medications and supplies at no charge. If you're cardiovascular issues, you get all your generic meds at no charge. If you're asthma, COPD, you get your generic meds along with your preferred brand, because there's no such thing as a generic inhaler. So we gave away stuff. We introduced, from that point, health coaching to work alongside with our folks, and then we revised our health plans to further drive participation and engagement within the health. We have two basic plans. We have what I call the Plus Plan and the Engagement Health Plan, where the people that are involved in that take their health risk assessment annually, take biometrics when we determine it's appropriate, and basically they also agree to work with our health coaches if they're contacted. We have the other plan, is basically what I refer to as the I don't give a damn plan. So if you don't want to do any of that, just stay on the basic plan. And that basic plan has 15% participation, and we have 85% participation in the other one. Undergirding all this, and it just really sings my song, is a heck of a lot of data. We have medical claims, pharmacy claims, medical records, performance evaluation, time and attendance, workers' comp information, dental, vision, and now hearing as part that we basically pulled everything together to push everything forward. What we've done so far has been fairly successful. But before I actually get into some of and I've got some numbers I'm going to share with you in a minute because I forgot which direction my slides were running, I want to talk about some of the overall impact we had. And success basically gets into, and this slide basically talks about how does health fit into this whole overall concept and things. Have we actually improved health, and why is health important? Well, believe it or not, you do a better job if you actually show up. And that's what this great study pointed out when it came to teachers. But another thing that comes out in teachers, you think about what happens in a classroom when a teacher doesn't show up and how effective that substitute teacher was when you're growing up. How much was ever accomplished and performed. There are studies that say that basically if a classroom teacher is out of the classroom for more than 10 days, their effectiveness drops to that of a teacher with 1 or 2 years more experience. The profound impact that has on education, studies have shown that basically a teacher really hits her stride about year 3. Other things that I've been looking at within our system will show that for the majority of my high schools, I can correlate the ACT scores to teacher tenures by the factor of 2.1. That if I sit there and I look at the average service years of a teacher times it by a factor of 2.1 for the majority of our schools, I'll actually come up with the ACT scores of that population. The things that we've done have been able to impact teacher attendance. We've actually reduced the amount of sick days by 1.14 days over the last 4 years. The number on the bottom of that screen is actually a correlation into teachers' health. Believe it or not, healthier teachers are in the classroom more often than least healthy teachers. In fact, we see a factor of 3.5 days difference. We also noted that healthier teachers actually receive better performance evaluations. In the fact that at the point that, as you can see here, the ones with the lowest health score, or the well score indicator, actually had the highest prevalence of poor performance evaluation, with those on the highest had the best. And overall, that trickles all the way out to the students. What we've seen within our students and our student population, this graph actually shows by school clusters the impact of health on the correlation between health and ACT scores. The number in the brackets on the left is actually the average age of the teachers, and what you see within this whole thing is my schools with the least healthy teachers also have the lowest ACT scores in that cluster. Those with the highest wellness overall had the best outcomes when it comes to student performance. The oddity that also ties into that is I have my older teachers with better health scores than my younger teachers. And so it really gets us into trying to understand what's going on. One, we're trying to come to grips with the situation is, are basically sick teachers making bad schools, or are bad schools making teachers sick? And I think we've come to the idea that the answer is yes. Also, what's going on is I think we also have a case study and something that we're working on as we're looking forward more into the resiliency of our folks. In the fact that with the younger teachers, what's happening with them is they're going into our toughest schools, I would have to say, the ones that are most economically disadvantaged. If a teacher stays in the system, they're going to migrate over to the magnet schools and such. And we're looking very strongly at this tying together the stress and the impact of the workplace. And not only is it hurting us on health, it's also hurting us on teacher retention, as these same young teachers that are going into the tough schools are sitting there with turnovers to where 20% of them will leave us during the first year, another 15% after that year's over, another 14% after that. All in all, I'll lose 60% of my new teachers by the time they hit the end of year 4. And so everything we're doing right now, trying to focus in on where those teachers are and what we can do to help them out. Health is a big component. We started with our $500,000 investment in 5 classroom portables. I'm now investing over $6 million to expand that facility and basically implemented a primary care center with an integrated health approach. I'm adding on to our primary care with physical therapy, chiropractic, expanding out my health coaching, adding in behavioral health, adding in exercise area, also adding in pharmacy and adding in more teaching and coaching time. And we're going to be working more and more to see what we can do to further move the dial and help improve health and attendance and retention.
Hi everyone, I'm Olga Rupert. I am responsible for benefits and compensation for Hub International, and I'd like to give you a little overview of Hub and our strategies and how employee health fits into our business as well. So for those of you, hopefully some of you are familiar with Hub. We are ranked 9th among the world's largest insurance brokers. We focus on property and casualty, employee benefits. We have personal lines as well. One thing we're really great at also is buying other insurance brokers. So we've had over 350 acquisitions since our inception in 1998. And as you can imagine, that creates quite a challenge with our healthcare platform and trying to get employees educated and involved and engaged in our benefits platform as well. We have 9,000 employees, US, Canada, and Puerto Rico. And one of the things I'm most proud of at Hub is that in 2015, we were recognized as a healthiest 100 workplace in America. We actually ranked as number 35 on that list. So that is a great achievement for us because we're working hard at Hub to help our employees live healthy and productive lives. Our top benefits priorities are really to support, attract, and retain key talent. That is a huge initiative for us. So to the extent that benefits can help us, we are very focused on that in how we deliver our benefits, in what we deliver as benefits. Last year, we went through a lot of changes to try to create more of a portfolio design for our benefits so that employees can have options to choose from throughout their career at Hub and their lives. So we're attracting a lot of younger workers now, but we have a lot of mid-career workers as well that we want to be able to retain for a long time to help build up our business as we go forward. So we want to definitely make sure that our benefit plan is more than a single option health plan and that we have many different benefits for folks to choose from to help build out their own portfolio of benefits. And that is one of our key initiatives also, to continue to build that out, to also look at some regional options. And I'll talk about this a little bit as we touch on some wellness topics on our panel today. But we've learned a lot that people aren't the same in all different parts of the country. So we want to make sure that our strategy includes regional options as well. And health management and wellness initiatives are key to our organization. In fact, if we start at the top with our CEO, we really started thinking about health as our health plan. We're an insurance broker early on in our business. And as time has evolved, employee health has become really a top business priority for us. We know that the equation for us is healthy, happy employees equal happy customers. And that's really ultimately what our goal is, that we are here to serve our customers. And we know that if we can work and help educate and activate and support our workforce on their journey, that we will in turn have happy customers that stay with us for a long time. And one of the things I also wanted to get us thinking about is, how do we measure health engagement? And I like to think about health engagement at the very beginning of the employee-employer relationship. We really want to make sure that we are onboarding folks with a very good understanding of what our benefits platform is and how it could help support their lives, and want them to take real active, engaged participation in enrollment. And I think that that's sometimes overlooked as very important in terms of getting folks access to information so they know where to go, what to choose, and where to go when they need help. And we also try early on to get folks engaged in screening through preventive health and our screening program as well. And then another key imperative for us is that when people need help, that they know where to go. So we're really trying to focus now more on tools and information to help our workforce understand how to choose their providers, what the best price is for the best provider in the most appropriate setting. And this is an area that we don't have a lot of data on yet. We're really just embarking on that right now. But we know that the end result is that we want our folks to be able to choose the best provider at the best price in the most appropriate setting. And I think we'll talk a little bit more about that in our panel discussion today.
Hi, everyone. I'm Kristen Vajura. I'm with Zurich. Oops, I'm not sure what happened. We are an insurance company. We're based in Zurich, Switzerland. That's our headquarters. Our U.S. headquarters is in Schaumburg, Illinois. We are located in 170 countries. Globally, we have 55,000 employees. In the U.S., we have just under 10,000. We had an acquisition in April that put us at that number. Prior to that, so the counts that I'm used to saying are closer to 8,000. We are in the U.S. we're the largest underwriter, or the largest writer of franchised auto dealers. So when you go to the car dealer and they ask you for the warranty, that's Zurich a lot of times underwriting that. We're the fourth largest writer of commercial property insurance, and like Olga, we have also we do have an award-winning wellness program. So one of the things I'm most proud of is that we last year won the Platinum Award for the National Business Group on Health, Best Employers for Healthy Lifestyles. For health in the organization, how we really look at health from Zurich's perspective, one of the things that we're very proud of at Zurich is that we're a values-based company. So our Zurich commitment states that we care about our customers, our shareholders, our people, and our communities. So obviously the health within the organization is really under the we care about our people value, but we look at health on multiple levels. So there's health from, again, similar to Olga, from the attraction and the retention program. We want to be the employer of choice. We know that we don't make anything, so our people are our biggest asset, and it's important to us to make sure that we're offering comprehensive and competitive benefits. We also look at it from the senior staff perspective. So from executives, are they champions of wellness? Are they leading walks? Are they making employees feel like they have the option to take a break and to have and to take care of themselves. And then just the overall employee well-being, which really falls under the we care about our people commitment. Our health priorities, for Zurich, we have come out with our mission, vision, values, and our mission at Zurich as an insurance company is to help our customers understand and protect themselves from risk. So in the benefits department, when we looked at wellness, we really thought, you know, if this is our mission for employees, what we need to be doing is helping our employees protect themselves and mitigate their health risks. So when we looked at that, we actually changed our wellness program. We used to have completely a participation-based wellness program, and we realized that if our employees don't know what their health risks are, then they can't protect themselves from that. So a couple years ago, we moved from incenting people to take a health assessment and do a biometric screening, join a walking challenge, to really having that gatekeeper. So in order to get an incentive for our wellness program, we now want our employees, they have to do both. They have to do a health assessment and do a biometric screening, and that's to get $100. And then we give an incentive, a $50 incentive, if you meet measures. So it's $300 total, $50 for cholesterol, $50 for glucose, BMI, and blood pressure. And we actually this year just increased that incentive. So last year it was $200, this year it's $300, and we've now introduced that to spouses as well. So spouses can earn $100. You have to be covered under our plan from a spouse's perspective, but for employees, we actually make that available to any benefits eligible employee. So we do want to make sure that our employees, again, are realizing what their risks are and then can move forward from that. We do offer, like I said, the multidimensional wellness. So in addition to the wellness program, we do have disease management, and we actually have a total population health management approach. So Health First is our internal branded wellness program. And when you call into our vendor, so if you're calling about, it's actually a concierge service as well. So let's say I'm calling our vendor to say, hey, I need to find a primary care physician in my area. Can you give me somebody, can you help me find somebody? They will go through and they'll actually see, you know, I see that you haven't done your preventive screenings, or I see that you, maybe there's something from their claims that is flagged that they are diabetic, or so they can take that information, and then when the employee calls in, they can actually reach out to the employee, which has been helpful. We've had quite the journey for our wellness program. We just moved this year to a more gamified, which I know is the big buzzword, a gamified approach to our wellness portal. We actually offered, starting last year, a diabetes prevention program that's in the form of a weight loss program to our employees. So we had a diabetes prevention program that we just had started, but what this program does is it's really about, you know, people don't really want to hear about, I would need to manage my diabetes. They want to hear about, I want to lose weight. I want to look better. I want to feel better. So we actually don't market this at all as diabetes prevention. It's marketed as a weight loss program. You have to have a BMI of, I think it's 27 or above to get in, be covered under the medical plan, but you get a whole kit of free stuff. You talk to a coach, and it really, we've had, of our employees, I think we had 800 employees who joined the program within the first 4 months of rolling it out. So employees are calling, they're engaged. We all know that employees love free stuff, so you get a whole kit, you get a scale, you get a food scale, DVDs, et cetera, that's really brought our employees in. We also have telephonic coaching, nurse line, tobacco cessation. We do have a strong wellness champion network, so we have 12 different areas or 12 different locations that we have wellness champions. We now have employees contacting us to say, you know, we don't have a wellness champion group at our location. How do we start? And it went from actually reaching out to get an executive sponsor to do that, to start a group, and then asking who could be the wellness lead. We jokingly call that you were voluntold. So we'll reach out and we'll say, you know, so-and-so, a senior staff member, they said that you would be great for this, because it's difficult to say no when a senior staff member volunteers you. But now we have people who are reaching out to us saying we would like to start this at our group or at our location. From defining engagement, we do still look at engagement from the participation perspective. So like I said, we have the health assessment and the biometric screening. And to get the money, you do need to complete both. So we've had, given that we just have an incentive, it's not a premium reduction, we feel that we've had good participation in our in our programs. And one of the things that I think is interesting is that while the percentages are different from the biometric screening to the health assessment, and those who actually complete both, so 35% of employees do both, they actually do the gatekeeper. 40% of our employees complete the biometric screening last year, 36% completed the health assessment. What's interesting to me is that we know that people are actually doing the biometric screening, not necessarily to get the money, because only 35% completed both, and it's not the same group, and obviously more people are doing the biometric screening than are completing the health assessment. So to me, that means that people are, I mean, it's a small number, but people are engaged, and they do actually want to know the information and take the step to understand their risks. We also survey employees, so one of the great things about having wellness champions and having an executive sponsor is that we can send a survey out each year. So we do survey employees at the 12 locations. The email usually goes out under the senior staff member's name. That helps get people's attention. But we also know just from the completion of the surveys that people are engaged. They do want to know more about wellness. And then we also look at what the results are, obviously, as well.
So I titled my presentation Employee Engagement in Challenging Times. So let me tell you first a little bit about Kenagra Foods. Kenagra Foods is in just about every cupboard in America with one product or another. So, and we're also the #1 manufacturer of French fries in the country. So kind of an interesting tidbit I like to share is when you compete with McDonald's and Burger King and all the other fast food restaurants to who has the best French fries, they're always competing with the French fries made by Kenagra Foods. So that's kind of just an interesting point. So many brands all over America. So with respect to our priorities, it's keeping costs contained, increase wellness participation, and improve our biometric scores, those things that are tangible that we can actually measure. Employee engagement to promote better consumerism. And of course, you know, that's not a typo. It's always about keeping costs contained at Kenagra Foods because it's a low margin business and $6 million is a penny a share to our company at the time. And so, when we were a company spending $280 million a year in healthcare, when you can shave a few points off of the healthcare spend, it has a direct impact to the share price on Wall Street. So, very busy slide here, but I would tell you about our healthcare strategy. We, in our salaried population, have 83% of that population engaged in a health savings account. And where our average health savings account balance, because we've been in this business for a while now, is over $3,500 for an HSA balance. And to get an HSA contribution from Kenagra Foods today, you have to play by the rules in the wellness program. So the wellness program is getting on a scale, having your biometrics taken, and then checking those scores from the biometric screening to see where you are. And if you have 4 out of 5 of major biometrics that are listed here, you get the full incentive. So you have participation, which is up to $1,800 to an HSA account. And if you have 4 or 5 of these biometrics, that's up to an additional $1,500 in premium reduction for participation in the wellness program. And it is participation in the wellness program is, because of the high incentive, is in excess of 80%. So money does talk. So in terms of defining and measuring engagement at our company, it's you cannot manage what you do not track. So early on in our wellness program, I tell you, we struggled getting a hold of the numbers. We did not have a good vendor in that space, but we've since got a vendor that is really measuring the population, and we're able to track cohort groups throughout the years to see their progress through their biometrics and the wellness program participation. Also getting input from our customers, because at the end of the day, it has to be a benefit, and no one ever says thank you for saving a dime if they don't get their drugs on time. That's something I say. So input from our customers, our population feels very free when there's an issue to put that up on the company bulletin board to say they're having this issue, which can then sometimes create more chatter within the company bulletin board system, and everyone has opinion on what needs to be improved. So from Yammer, from surveys of our people that are done by our own vendors, and we get the results of those surveys. Through our HR representatives, where the HR representative in our company is very important in the plant relationship. We have over 100 locations and plants across the country, and that HR representative is the advocate for the employee groups as it comes back to corporate at Kenagra Foods. And a bunch of data observations that really just lead to insights. So for example, we have a transparency vendor, we're using Castlight, and that is in our high deductible network plans. And there are many observations you have from your tools, but the key is to take all those observations and come to an insight that says whether or not it's saving money. Because you never know that a person went to a lower cost provider because of Castlight. Maybe they were going to go there anyway. Maybe it was just luck, right? But if you track the observations of thousands of people going to the tool, we see that on average, when people use the Castlight tool, for example, they're paying 36% less on an MRI. They're spending 20% less on blood work. So we know that people who are engaged in their healthcare, people who shop for quality and cost, will save money, and that leaves more of their HSA balance for themselves for retirement or for other needs. So that is a key in Kenagra Foods, because we're also marketing of food, and in our own process, when we do observations of our customers and popcorn, for example. Maybe you remember some of those popcorn commercials with Orville Redenbacher. Those commercials came about from cameras that were in people's homes. We paid to put those cameras in people's homes. And the observation was that when mom got on the stove to make popcorn, all of a sudden every kid came out of the woodwork. Homework stopped because they could hear and smell that popcorn being made. Well, that was just an observation, right? So then they said, now how do we take those observations to lead to an insight to help sell the product? Well, the observation was it brings the family together. So that's something that we've learned in our benefits team based on our marketing efforts from our marketing team.
That's great. Wonderful. All right, thank you, you guys. I almost want to give you a round of applause now because you guys have done a lot of work in this space. Let's do that. Wow, this is really a great group up here. All right, so I want to dive into some questions here. I do have some planned, but at the same time, I know there's a reason why you've come here to listen to everyone today. So I want you to think of your key questions. I think we do have somebody running around with a microphone, so we'll make sure we get to those questions as well. So let's dive into the first one. You guys have been looking at, you guys obviously are very thoughtful with your benefit strategy. So what is it, what changes have you made, or what is it that you've put in place to help them navigate the healthcare system? How are you helping them navigate the healthcare system? So David, let's start with you.
You know, I've taken the approach that I wanted to make it simple. I keep our health plans very simple. You have the Plus plan, you have the engagement plan. It's a simple network, it's a simple concept, and I'm trying to drive everybody into our own primary care, but I'm not forcing them, I'm nudging them along the way. Because once they're in there, we actually have more control over the whole downstream, medical cost continuum. We actually show that the folks that are being managed by our on-site medical have a better health and lower costs than those being managed by other primary care providers. And so if I can get them in our network, we have our own referral coordinators, we have our nurse practitioners, we have our health coaches, and so it's a very personal approach, and it's a very simple approach, and that's what we're focusing on.
That's great, thanks. Olga?
Yeah, I agree with you on the simple part of it. It's very important to try to keep things simple for everyone and even for myself. So one of the things that we did is we tried to consolidate. There's the technology piece of simplicity and information, and then there's the human piece of it. And we've tried to make sure that we're touching both sides of that equation. So with regard to information, we have consolidated most of our information under one platform, so everyone has one place to go. Almost. That is a goal. So whether or not you have a wellness concern, or you need to enroll for your health plan, or you want to access some of your tools or resources, you have one place to go. The other side of that is you also have one place to call. So we're really trying to advance our health advocate program to the point where if you need help, someone is there and able to even help you make an appointment with your doctor, kind of what you're doing, so what Zurich is doing. So that's really the end state, to have that kind of interceptor who's going to be there where you can call and they can just help you with anything. And you have that personalized care because very important for us to also just, in all that we're doing, recognize the care aspect of the employee-employer relationship too.
That's great, great. Kristen?
Yeah, I think similar to what my colleague said, simplification is key. It can be very challenging because there are so many tools and resources out there that employees have to offer. So we have a plan cost estimator, we have a treatment cost estimator, we have a treatment decision support tool. So how do you pull all that together? And I think having that, the one phone number is really helpful. So while we do have these tools, we have 3 different medical options, but only one provider. So we've got one medical provider, we have one wellness provider, and they're linked together. So like I mentioned before, we have the one phone number that employees can call if they need medical help. It can actually get them to their behavioral assistance program if they need that. If they're looking for a doctor, they have questions on the wellness program. It's one phone call, and a lot of times they can also then reach out to and provide them with what those other tools are as well. So I think that's a way just to bring it all together.
All right, that's great. Thanks. And Bart?
Well, I say one common theme is about getting rid of differences without distinction in your portfolio. So at one time at Kenagra Foods, we had over 50 active medical programs. And that's just because of the way the company grew. It grew from acquisitions, buying small companies, and treating things like independent operating units. Well, the last 10 years, Kenagra Foods has been bringing it together and getting rid of a lot of those differences that didn't really add a whole lot of distinction. So when you start getting smaller complexity, you're able to start managing that complexity. So we did a full replacement on high deductible health plans in our portfolio in 2008. And at a time when there really weren't the tools available to help people navigate high deductible health plans. So as soon as those tools did become available, the Castlight, for example, when we implemented Castlight, it was one of the most buzzed implementations or anything that I've ever worked on with our employee population. People loved the tool. And they loved it because it was easy, and you clearly got to make it easy for people. I had one person say, now I know where I can find a doctor in the network in the town that I'm moving to. You feel like saying, well, you could always do that before by going to the carrier website, but it wasn't easy, right? So now they had the Castlight tool, and it was easy, and they loved it. So it's being willing to dare greatly, as Teddy Roosevelt would say, to try different things, come to a conference like this and hear about different solutions. Because every single one of these solutions that are out there is likely a good solution when it's in the right mix. But as you develop your own strategy, you have to make sure that you're pulling what you need together that are going to augment one another. It's not too dissimilar from pharmacy benefits, you know? The reason why you have a PBM is so that you take drug A and drug B. Both are good drugs that help people, but together maybe they do some harm. Well, you got to make sure that the vendors that you hire in your portfolio augment one another and communicate together. Try to get everyone on the same page. And if a vendor's not getting the traction, you got to be willing to pull it out and try something new.
That's great. That's great. And, you know, to that point, it actually brought up a little bit of an organic question here around, because obviously you've been very thoughtful with your healthcare strategy. So, you know, I want to ask each one of you this question too, but what questions are you thinking about when you're thinking of that integration of vendors? You know, what key questions are you seeking answers to? Bart, let's start with you since you had that old wonderful conversation there.
You know, we can all know how to run a benefits enrollment. We all know how to do good contracting with our vendors. But at some point, you get done counting all the numbers. You got to make those numbers count, and that's the challenge. What do you do with the data on the back end? How do you take that information and go towards improving the health status, improving the business? How do you then tie health to the business? Does a healthier population, for example, in teaching, right? We saw how that leads to performance. We're doing the same thing in the plant structure. Does a healthier plant perform better than a plant that doesn't have as healthy a population? So it's taking that data, tying it together, and look at new solutions. We're evaluating private exchanges. We think that could be a great solution for a company as diverse as us, but we're still evaluating, no decisions made.
That's great, thanks. We don't have to go in round robin order, so if somebody else wants to jump in, feel free.
I would just say that the main question I always ask in anything that we do with benefits is how are we helping people? So whether we're how we're organizing our benefits, what benefits we're offering, how folks access benefits, what are the problems for the people that we're trying to solve. And that's really, really the starting point for me.
All right. Anybody else, David?
Yeah, I mean, to me, integration, it's all tying back into this whole health thing. And there's a lot of stuff that we don't understand yet, but we have to try to figure out. One of the things I'm working on right now is how the heck am I going to get chiropractors and physical therapists to work together in a cohesive whole? The folks here at the Center for Chiropractic Progress have actually been very helpful with some insights on that. And try to understand a little bit more of the dynamics, what happens out there in that delivery system, and how can we make it work together better? Because, what I've realized on PT and chiros, it seems like it's more of a choice. It's a broader net. It's more options to folks. But get those options working together. As Bart was saying, there's not necessarily one right answer for everything. There could be multiple right answers, but find the ones that will work with your population. My younger teachers are probably more inclined toward chiropractors. Old grumpy guys like myself would rather go to a physical therapist. But it's we need to reach the whole spectrum of folks.
Yeah, that's great.
Margaret, let me
Yes.
see if there's a question out here. Yeah, here we go.
Good morning, or I think it's probably afternoon at this point. Thank you so much for joining us. I appreciate everything that you brought to the table. But I do have one question, and it's for anyone on the panel. As we launch anything or start a new venture, typically there are things in hindsight when you look at it, you say, oh my God, we wasted so much time on that component. What would that be for you?
Good question.
That's a great question. We did everything perfectly.
You said you had to be able to pull things out, and it didn't work.
I'll start. I'll be quite honest. Our implementation of a vendor can sometimes be problematic, especially when you're trying to be on the cutting edge. So for example, in transparency, we were the first to integrate with Highmark on Castlight. And to be honest, the two didn't always want to play together. So we were right there at a week before the implementation, and we had to postpone it. I had made the call on the phone call to say that they needed to talk to each other because you only have one chance to make a first impression. So postpone that implementation by 2 months to make sure that when it did go live, it showed a person's actual deductible, not some ping that might have been a month old. So I would say that was probably from a learning on something else that didn't go so well. That's probably why I came to that conclusion, because you really only have one chance to make a first impression on anything that you do.
Anyone else?
Sure. I don't know if it's that we wasted time on it, but what I would say is that sometimes with wellness initiatives, we make the mistake of thinking that we know what everyone wants rather than just asking them. So if I could say that I could have had some learning on that sooner, that would have been good. But it took a while of launching a lot of one-size-fits-all programs in wellness specifically, and not really taking the time to get out to the locations and creating real location-specific initiatives that were meaningful to people. So that was not so much a time waster, but it's important to ask.
I think I'd key in, don't be afraid of wasting time, in essence, because there's a management guru from Harvard many years back that I can't even remember, Onken, I think is his name. But basically he said the mark of a professional is somebody who would turn his back on the known and the routine and venture out into the unknown. We have to have the freedom to venture out in the unknown and figure things out as we go along. And then don't be afraid to look underneath the surface to try to find the real reasons why things are working or aren't working. I've had to move one clinic out of one location because it wasn't hitting the targets, and there were some changes in the demographics and the population and actually at the facility where they're at. I've had 3 health coaches. 2 of them, one was doing phenomenal work, the other one is now picking up steam, and then we're questioning what's going on with the third, and figured out that it wasn't so much the health coach as it was the nurse practitioner and how she related with them. So, you know, a lot of energy is spent, you know, promoting and trying to push business when there's a lot simpler thing that need to be done over there, and that's basically fix some of the relationship issues and how people are worked with professionally. So there's always going to be ventures gained and lost and learned, but man, it's an education process, and if we're not afraid to waste time, we're never going to move forward. So.
I would say from the wasting the time, I think we all know how long implementations can take, and you're adding a new vendor, and or just offering benefits in general, and how much time you take managing those benefits. But if you're not communicating it and employees don't know, then you're kind of wasting your time. And we learned a lesson, or I learned a lesson, that mandatory exchange notice that came out. So when everybody had to send out the mandatory exchange notice to say, my company, my benefits, they, you know, they meet the requirements, they're good enough, we were told by senior staff, this isn't good enough. We want people to know that we actually offer competitive benefits. It's not just that we meet the standard, that our benefits are really good and that they're competitive and they're an attraction and a retention tool. And from that point on, we really took a marketing approach to our benefits. So now we really do look at it as an exercise in marketing where we're constantly advertising what we offer. Because if we don't do that, then employees don't actually value what we're doing, and then what we're implementing can actually be perceived as a waste of time if no one's using it.
Great, great.
Margaret, let me ask
Sure.
the final question here, then throw it back to you, maybe get final thoughts from your panelists and wrap it up. David, I was really fascinated. You took wellness data and you related it to sort of teacher performance. So you found out that teachers who are sick a lot don't have students performing greater scores. I'm wondering if there's some other, because most people take wellness or disease management and see how to improve the health of the individual you're targeting. You've gone across your business, your school education system with different metric data. Are there other areas where you're looking at wellness versus some outcome or performance from your organization and any of the others? Are you looking at something along the same lines, and maybe wellness is affecting some productivity standard or your retention on your sales force? I don't know what it would be, but you know, it kind of opened up a whole new idea for me as to how you might be able to use your analysis, maybe something called big data, so pulling things together that you might not have thought about.
Yeah. I've been spending a lot of time, and I'm working out this last part right now, trying to look at the health of teachers by school tiers, and also looking at our priority schools, our worst performing schools versus the rest of the population. What I actually found out, it was kind of interesting as I look at some of the things and where some of these things cross, is you know, the least healthy cluster of teachers that I have are actually my middle school teachers, which having a 14-year-old at home, I totally understand why, you know. So, I mean, it's a tough demographic. But then my least healthy priority school is actually a high school. And it's the same high school that had 60% turnover last year. Well, heck, is there something I can do that will help us keep the teachers there? Because you can't just take an experienced teacher, move them into a poor-performing school, and expect them to stick around. They'll just leave me too. But what can we do to basically help retain our teachers there? Can I take health coaches? Can I take resiliency? Can I take mindfulness? And not just build out a panacea product, but basically look at something that's more of a 3-year pilot to help develop these teachers out. So can we help? I can't fix the environment, but I can help the I believe thoroughly we can help the teachers adapt to the environment, especially these new teachers, and that's what we're working toward right now. So.
I have a comment on that. We are trying to tie our wellness or health results, wellness results back to our engagement scores. So when we first started with our location wellness initiative, we first went to the locations where we had the highest risk. And then we said, well, hey, wait a minute. Maybe we can influence the locations that are having some trouble with employee engagement. And so now we've even added a question in our employee engagement survey about our wellness initiative and how it's helping them. And then we're looking at the screening results for the locations where we do have some actual rigor around wellness locally, and their engagement scores to see if we've got some influence there. And it is showing possibly that we are making some traction there. So, yes.
I would just say we all know that people with more risk cost more to insure. If 5 or more risk, 2.5 times is more costly than someone with 2 or fewer risk. So we know that from our data. We're not able at our organization to actually match performance with health status. That was a legal issue that our legal team was concerned of. We tried. We didn't quite get that far. We're a very conservative legal team. So, but I love the stats. I mean, it just pans out. Healthier workforce is a better workforce.
Yep. And I think what you're doing is what every company would love to be able to do, is to tie it back. We haven't been able to do that yet, but it's definitely something we would like to do.
Yep. Thank you.
All right, that's great. All right, thanks so much for these questions. Wonderful. So I want to dive into just one area. You guys have put all of these strategies together, but what do you think is missing? Is there anything still missing from your strategy that you want to have come forward? I mean, do you have any big, hairy, audacious goal that you want to add into your strategy? All right, Bart, go for it.
I would say that to build it again, I like what I've done so far, but it's what do you do in the back end when you have all this stuff built? How do you get the vendors to play well together? So for example, I think we know that so often when a person goes in for a back surgery, they're in that same condition 2 years later. So they're not always successful. I would have loved that person to have gotten a medical second opinion through a service that we have. We use Advanced Medical. So these are Harvard Medical School trained physicians who will look at your case and render a second opinion. I wish I could get in front of all these claims to require such second opinions. But it's hard because the healthcare system just rushes right through. And by the time that information gets back to the carrier and back to us, they've already been under the knife oftentimes because it was done in a different state, it traveled through the Blue network. It's just hard to make everything work together well.
All right, great. And however, you're doing a really wonderful job. So, all right. Olga?
I wouldn't say that it's missing from our strategy. It's just not evolved as far as I'd like to see it, and that is the whole actual helping people navigate through the healthcare system with great information and support that's more personalized through Advocacy Program. I don't like to call it a program. I think that there are some opportunities there to really help folks and make sure that they're getting the best care in the best setting, but that a tool online on a website isn't enough for them. So that's something that I'd like to work on more.
I think healthcare is evolving so quickly, and what's offered is evolving so quickly that we probably don't even know what's missing yet. And I mean, because you go to conferences like this and you hear things, and it's the COEs, it's ACOs, it's neural networks, and how do we take these things and apply them back to our company and our strategy and what will work for our company, but also what will resonate with our employees and what our employees will be able to understand. So often, we hear these things at conferences like this, or you read periodicals, and we know what it means, but to try to build that into your strategy and then bring it out to employees so that it's comprehensive to them, it is difficult to do. But things are changing so quickly that it's difficult to even know what we're missing, I think.
All right, fair enough, fair enough. David?
We're going to continue to build out this integrated health with a primary care core model. At the same time, we know that there's some opportunities downstream in a true ACO arrangement. Right now, our clinics are actually operated, we have them on contract with Vanderbilt, and we retagged our clinics about a year ago as Vanderbilt Health at MNPS. Well, Vanderbilt's a very specialized specialty hospital and hospital system that doesn't have a strong primary care presence. We have a strong primary care core that we're building, and we should be able to work out some profitable arrangements downstream. And so we've been in discussions and trying to figure out how that works, but not basically something that I can attach and to build on more to help us more with the downstream opportunities. So that's where we're heading.
All right, so I have a couple more questions. Any other questions out in the audience at all? Okay. All right, so I want to bring us into our final question then. Taking a look at demystifying healthcare, you guys have looked at a lot of advocacy and support, but really, have we relied on tools too much to help employees become healthy?
And what do you think the future direction of your strategy is?
So we do offer quite a few tools. We actually, when we had the acquisition, we went out to the different locations and we talked about our benefits, and I was tripping up over what tools we offer. So when the benefits professional is tripping up, you know that there are a lot of tools. I think from our culture though, we are an employee self-serve culture. So we do ask our employees, we're full replacement. We, even from the HR perspective, we have employee self-serve. So that's really the culture of Zurich. And I think, you know, looking at or listening to the millennials who are up here, or that panel, it seems to be the way that companies are going, and the way millennials and the way the future workforce wants it. So they want things now, they want it at their fingertips. I think the biggest challenge is, how do we channel that? So how do we make it, and it sounds like maybe you've done that, how do you make it easy for employees? And you know, we come here and there are all these different vendors and they all have really great products and they're all niche products. Well, how do you bring all that together into one area, or is it one app, so that you can say, okay, this is the app you're going to go to for Zurich Benefits, and you can find your medical card, your prescription card, you can go to your wellness program. How do we bring all that together? And I think that'll be the next step, because right now there are tools, but it seems very fragmented a lot of times, for me anyway.
Okay, great. Anyone else?
I would say,
I know Olga's biting at the bit.
Pardon me?
I said you're biting at the bit for this one.
Well, just in terms of employee health, employee wellness. So I think that with regard to the traditional thinking, or what we do for wellness, that yes, for wellness, we have definitely relied on tools too much, and that if you get out there and you ask your people what they want, it's very unlikely that someone is going to say, I'd like another online challenge. So I think they're great. They have a place for us. But for employee health and creating a real culture of health, you need to get into your environments and help people create their own environment based on what they're looking for, rather than just cranking out tools for them to engage in. So it's sometimes a lot simpler than we're making it.
Okay.
I was just going to say, with the tools, I think we're always going to have tools be a part of our portfolio, whether it be a transparency tool. So long as there's an ability to cut a cost because of something you put in, someone will develop the tool and we'll be out there buying it. Because it's a process of continuous improvement. You're never done in this job. None of us are ever done. We're always coming to here, and I've never heard anyone say, I came out of something like this without a few ideas. You always get a few ideas. And that's what makes this business fun, is that you're continuously working to make it better, owning what you build, measuring what you build, and trying to make it better. Even though when you think it's great, it can always be better.
Thanks. David.
You know, when it comes to tools, I've taken a very personal approach with very few tools as we've launched our whole thing. But what I've come to realize on the opposite side of that is that I can't get to everybody face to face. And so tools are a necessary component. And so, but as I'm going forward, we're working on a few tools that we're going to integrate in with our approach and make sure it still drives back to our primary purpose and our primary focus. But you know, and if I'm going to be able to spread a net wide enough to grab everybody, you have to have them. And so we're going to be working more in that space. So.
All right. Okay. Any final thoughts here in regards to your benefit design that you want to share? Any lessons learned that you want to share for employers? What's something that they can take away from today? Just name one thing, and we'll just go around the table, and this is it. David?
All right. It's all about health. You know, focus on health and cost will come. So.
I agree with that 100%, and find ways to find out what people need and help them in that way.
Yep, and I would say if you're a large employer that has sites all over, that wellness champions really do work. To Olga's point, you can focus on what the different locations need, because different things resonate with different locations. So it becomes not a one-stop shop for everything, or a one solution.
I'd say it's communication, which I'm an actuary. I don't think I mentioned that, but so I grew up counting numbers an awful lot. But one thing I've learned is communication is more important than the best bean counting you can do out there. Because if you don't communicate the program, if you don't communicate the tool is there, the utilization will go down. And I saw that personally, when we acquired a large organization, almost doubled our size, and that integration was difficult. Well, it quieted down all other communications because the focus was on integration of that business. Well, healthcare suffered because of that. Utilization of second opinions went down by 2/3 because people just forgot that it was there. So you have to communicate, and you got to make it a part of the annual strategy for the organization.
Great. All right, want to thank you all. Let's give them a round of applause. Thank you so much. All right, everybody, and thank you very much.